welcome Dr. Babatunde Salako. Please put your hands together for Dr. Babatunde.
Great Fego86 set. Great Fego86 set. If you guys don't know, this is the best set that ever graduated from Odogbolu. So let's give ourselves a round of applause. The purpose of bringing this is for all of us to be aware of our health. You know, most of us are over 40. I don't see anybody that's under 40 here right now. So if you are under 40, you can step out. After the lecture, you come back. So this is what I do. This is what I practice in Northern California. I'm a physician, and I'm a primary care physician and obesity specialist. So all I'm going to be telling you is about how to stay healthy. I realize in Nigeria, we do not pay a lot of attention on our health. We focus more on the economic situation and on how to put food on the table. But I just want you guys to be aware of things when you see your doctors, what you need to ask them, things that you need to just focus on. Dr. Ndia will be helping me here today, our great footballer. So next slide, please. Healthy lifestyle is what we're going to be talking about today. What you need to do to stay healthy. Health is a state of complete physical and mental well-being, and not just the mere absence of disease. Most of us think those who are not healthy are the ones in the hospital. But you know, our physical state, mental state is all important when we're talking of good health. Next slide, please. When we talk about healthy lifestyle, if you look in the middle, healthy lifestyle, we're talking about eating healthy, we're talking about regular exercise, and we're talking about stress reduction. That might be difficult in this society, but we have to try our best to reduce stress. You know, stress can lead to myocardial infarction, can lead to heart attack. So many people will just be driving and they go. That's because everything is too stressful for them. Let's find time to relax, time to rest, please. At least 7 to 8 hours of sleep. You need it. You need it. Contrary to what people are telling you, you need your sleep. Okay? So drink plenty of water. Those at the back, water, please, not Hennessy. Plenty of water. Next slide, please. So good health is above wealth. I love that. In Nigeria, people focus on making money. They go all around, they don't rest. But when they make this money, they drop dead the next day. So good health, staying healthy, 2 liters of water, walk on fresh air, take a lot of fruits, lots of vegetables, and exercise. Before I left this country, when they talk about vegetables, I always think about efo. When I got to the United States, when they told me these are vegetables, I said, come on, in Nigeria, we eat efo only. Give me efo. So when we talk about vegetables, we're not only talking about efo, we're talking about things like this. These are things, they are antioxidants. They can really help you. Stroke reduction, these are the things you need. Most of us, when I came back, when I see people eating a big bowl of rice, there's no single vegetable there. That's not healthy. If you go to outside the country now, nobody eats like that anymore. The healthy plate is the kind of plate in front of you, you divide it into 4. A quarter will be for your protein. A quarter will be for your carbohydrates. Half of that plate should be your vegetable. A quarter. Oh, sorry. Let me come back home. You guys know we got to do what we got to do, okay? Let me come back home. A quarter. A quarter. Okay. So a quarter should be for your protein. A quarter should be for your carbohydrates. And guess what? Half of that plate should be your vegetables. If you're not doing that, you're not eating healthy. Let's start practicing that. So when it's time to eat, I want to see your vegetables. Next slide, please. So adopt a healthy diet, practice a healthy lifestyle choices, make a lifelong commitment to fitness. You know, one thing I notice here is that a lot of us, we do exercise without knowing. But some of us When we get comfortable, when we start making money, we forget about exercise. We have our drivers, they drive us from one place to the other. That's not healthy. If you know you have a driver that drives you around and you're not exercising, please join a gym. If you cannot join a gym, start 30 minutes of exercise every day. When I say exercise, I mean things that can increase your heart rate, that you can breathe in and out. I'm not going to give you examples. Just know things that can increase your cardio-metabolic rate. So 30 minutes is what the WHO recommends. If you're doing that, congratulations. If you're not doing it, it's time to start. So next slide, please. I'll leave you with this quote by Dr. Martin Luther King. If you can't fly, run. If you can't run, walk. If you can't walk, then crawl. But whatever you do, just keep moving. That also applies to life. Do not be static. Be a dynamic entity. Keep moving. Exercise. Do what you can. Dr. Olabi can attest to that. Dr. Oyemabi can attest to that. Shagwald, you can also support in that. So let's go to the next slide, please. Now we're going to be talking about things that everybody needs to know. I don't know if you guys all do this, but I want you guys to just pay attention. I'm going to rush through this, but I want you to know. Dia, next. So this is what we call screening. In the United States, we spend a lot of money in screening. We do not want to treat disease conditions. We want to prevent them. So the government pays a lot of money. Medicare pays a lot of money on this. So I want you guys to know, if you see your doctors, if you're not doing this, you need to talk to them. Find out when you need to do it. Breast cancer screening, mammogram is recommended for anybody 40 and over. Annually was the previous recommendation. There's something new now. They do it every 2 years in the United States. It might be different in different companies, in different countries. Then physician breast exam is recommended when you go for your physical once a year. Then self-breast exam is also recommended. So many patients have been to me, coming, doctor, when I was in the shower, I felt this. And guess what? It was cancer. But we caught the cancer at the early stage. We did a lumpectomy, and she's cancer-free. So examine yourself in the bathroom every day, please. It's very important. Something as small as a very tiny thing could be cancer. You can detect it, come to a doctor, they'll figure it out. Simple lumpectomy will take care of it. Lumpectomy is just taking that thing out. We'll take care of it. Breast cancer is very dangerous because it can move directly into a very big artery in the back of the chest, and it can spread very fast. Next slide, please. My prayer is that when we do the 50th anniversary, everybody here will be present in Jesus' name. So this is something very important again. Cervical cancer screening. This is very rare in the cervical cancer is very rare in the United States as of today, because everybody does this. If you are in an insurance program and you don't go for your cancer screening, they will call you at home. They will call you at work. They will pester you to come and do this. Because just doing your pap smear regularly can save a lot. So when we do pap smear, it's recommended from the ages of 21 to 65. If you see there is something highlighted right there. In the past, we used to do it 3 years after the onset of sexual activity. That's no longer in the United States. We don't do that anymore. Everybody 21. Everybody 21. There's also one test we do, which is HPV. I did not learn that in Nigeria. I didn't even know what this meant until I got to the US. This is very rampant in the US. I don't know about here. So HPV is one of those sexually transmitted viruses that can lead to cervical cancer. So when you do a pap smear, when you see your doctors, just talk to them. If the doctor does not know this, you need to change your doctor. If you're seeing a doctor is just charging you money and they don't know all these things, change them. Because there's so many quacks out here in Nigeria. Next slide. So another thing that is important for us in this set, blood pressure testing. When you go for your physical once a year, let them test you and check your blood pressure. Let them test. A lot of people are walking around with blood pressure of 220 over 110. Any little thing will just tilt it over. That stroke. Hemorrhagic stroke, embolic stroke. That will not be our portion in Jesus' name. Any opportunity you have, just check your blood pressure. I'll give you a standard number. Any number below 140 over 90, you're good. That's all you need to remember. If it's above 140 over 90, see your doctor. and most of you travel out of the country, if you get all these blood pressure monitors, just buy them. Bring them home. They use batteries. You can use them and check your blood pressure. So next slide, Dr. Dia. Cholesterol. We eat a lot of meat in Nigeria, and you need to start checking your cholesterol. It's recommended when you go for your physical. Over there, they say every 5 years. Well, in my practice, I test people every year. Next slide. This is one thing that is killing blacks and African Americans all around the world. Diabetes. People don't check their blood sugar. We eat high carbohydrate index food. And when you eat that kind of food, you need to check your fasting blood sugar. If you have a family history of diabetes in your parents, grandparents, please check your fasting sugar once every year is what I recommend. They say every 3 years, but I do it all my patients every year. I check your fasting. Next slide. So this applies to you after the age of 50. Most of us have parents. We have people older. So this applies to them. What we do now, we do colonoscopy. I think they do it here, but not everywhere. We also do a test now. It's called FIT testing, fecal immunochemical testing, which is occult blood testing. We do it every year. If you become positive, then we send you for colonoscopy. But in advanced places, because of insurance and cost, colonoscopy costs $1,000 if you do one colonoscopy. So a lot of insurances are being careful to pay for that now. So we do FIT testing, very easy. Send a stool sample to the laboratory. They check for microscopic blood. If it's positive, you go for colonoscopy. If it's negative, you do it every year. Next slide. So prostate cancer screening is very controversial. Very, very controversial over there in the United States. But if you have a good doctor, my advice and not their recommendation, let them check you out once a year. I've diagnosed a lot of men with prostate cancer. I don't play with it. When I see you, especially older men with low back pain, is something you need to suspect. We start seeing them, people above the age of 60, 65, they're having low back pain, please test them. So let's go to the next slide. So testicular exam is no longer recommended in the United States, but self-testicular exam is still encouraged. So when you feel anything, you talk to your doctor. Next slide. So osteoporosis does not apply to us yet, but there's something they call osteopenia. If you're a woman here today above the age of 40, I encourage you to start taking calcium and vitamin D. Osteopenia just means reduction in bone mass. If you take calcium and vitamin D, you're going to prevent that. Osteoporosis, we start screening people age 65 and up, or people with family history who have ever suffered a bone fracture. Next slide. Dental exam, twice a year, please. Guys, invest in taking care of your teeth. It's very important. Next slide. Eye exam. You see, glaucoma can lead to blindness. So many people are walking around with high pressure in their eyes. If you don't get your eye exam done, how are you going to know? The next thing is your glasses become thicker, and you're thinking, oh, my sight is just getting worse. It's just hypertension of the eye. Get it checked. It's a very simple test. They have pressure they use right now. They don't need to touch your eyes. They tell you the pressure. If it's there, they start reducing the pressure, and you'll be fine. Next slide. This is a new thing in the US now. We do low-dose computed tomography just to screen for lung cancer. Lung cancer is very dangerous. Whenever we diagnose it, we give people 6 months. 6 months. Because once we diagnose it, it's gone. So we're doing a CAT scan on them now. Anybody who has a 30-pack year of smoking history, and or somebody who currently smokes, or those who quit in the last 15 years, we do this for them just to screen for lung cancer. Next slide. The purpose of this is just for you guys to be aware of things you need to discuss with your doctor. My 3 things I'm going to leave with you guys today. Check your blood pressure. Check your blood sugar. There are a lot of people that are diabetic in this country, walking around, no treatment. And do your physical once every year if you can afford it. If you can't afford it once every year, do it every 2 years. Thank you very much.
Put your hands together for Dr. Salako. Thank you very much.